بسم الله وعلى بركة الله والصلاة والسلام على رسول الله. Sisters and brothers, Assalamu alaikum wa rahmatullahi wa barakatuhu. It's a pleasure to be talking to you today. I would have liked to be with you in person, but circumstances have not allowed me. Inshallah, on another occasion, we shall be able to be together in person. Our discussion today is about disease prevention and health promotion from the Islamic perspective. I think that we need, as medical practitioners and health professionals, to start looking at this Islamic dimension in a very serious way. Why? Because we have got all the scientific knowledge needed to prevent many diseases. But in practice, the diseases are increasing because these are diseases that have to do with human behavior. Diseases related to nutrition, related to smoking, related to lack of activity have to do with human behavior. To change human behavior, you need something stronger than just giving them knowledge of the risk factors. That's where religion comes in. If we can contextualize our health education messages within the Islamic framework, I am of the opinion that the people will take this message more seriously, they will internalize it, and they will act on it more vigorously with consequent improvement in the health conditions. The Islamic perspective of disease prevention and health promotion can be looked at from two major visions. The first vision is the vision of the legal, of the Sharia basis for prevention and promotion. The second one is the concept of balance and moderation that is central to Islam, that also is very important in disease prevention and health promotion. The legal background is that prevention is a central feature in our culture and in our religion. And the Quran talks a lot about prevention, al-wiqaya, prevention from entering hellfire, al-wiqaya min al-nar, prevention from punishment, al-wiqaya min al-dhunub. The Quran tells us, for example, talking about our families, qu anfusakum ahlikum naran, prevent yourselves and your families from hellfire. So prevention is very important. It means taking measures to prevent a bad outcome. This does not run counter to qadar, or the predetermination of Allah subhanahu wa ta'ala, because disease and its prevention are all part of Allah's qadar. It does not mean that when we try to prevent disease, we are working against qadar. Both the disease and its prevention and its treatment all happen because Allah wishes. So there is no concept of trying to counter the qadar or the predetermination of Allah subhanahu wa ta'ala. The other legal basis is qawaid al-fiqh and maqasid al-sharia. Our law has got principles called qawaid al-fiqh, and it has got purposes called maqasid al-sharia. Let me start by talking about maqasid al-sharia. In order to have a well-balanced life, to live a healthy life in a healthy community, we need to observe and fulfill and not contradict the 5 major purposes of the law, maqasid al-sharia. And these purposes are, the first one is hifz al-din, preservation of morality and religion. The second one is hifz al-nafs, preservation of life and health. This is where health and medicine occur mostly in the second purpose of the Sharia. The third one is hifz al-nasl, protection or preservation of the family, of the lineage. So anything we do in having safe pregnancy, safe delivery, pediatric care, all of this come under this rubric of protecting and preserving and promoting the family. The fourth purpose of the law is حفظ العقل, protecting and preserving the human mind, because the human mind distinguishes us from animals, from other creations. When we lose the mind, we lose our humanity. So when people drink alcohol, when people take drugs, they are knocking down, they are denying the mind its role in life, and they are denying their basic humanity. So the law requires that we preserve the human intellect. The fourth purpose is حفظ المال, preservation of resources and not wasting resources. So these 5 major guidelines can guide us when we talk about disease prevention and health promotion. There are also detailed principles in the law that I will not cover here, called قواعد الفقه, that also can give us specific guidelines on what to do and not what to do. The bottom line is that if we follow these principles, we can have healthy and fruitful and useful lives in a well-balanced society. Disease actually represents a situation of disequilibrium. So Islam emphasizes moderation, at-tawazun. It emphasizes being in the middle, al-wasatiyya, and not going to extremes. So it's very important to know that we can eat food, but we should not overeat. Food is good. If you eat too much of it, you are going into extremes. And we pay by becoming sick, by becoming unhealthy. So a Muslim should have moderation in whatever you do, whether it is food, whether it is taking water, whether it is working. In all our activities, we need to stick to the golden mean. And the Prophet ﷺ, by practical example, did show us how we can maintain this middle of the way, this moderation in our lives so that we can be healthy. The Prophet taught that when we eat, we need to divide our stomach, our gut, into 3 parts. ثلث لطعامه, 1/3 is for food. ثلث لشرابه, 1/3 is for water or what we drink. وَثُلُثٌ لِنَفْسِهِ أو لِنَفَسِهِ, and 1/3 leave it empty. Which means that when we eat, we cannot fill our belly. We do not eat to fill our belly. And he did teach us that نَحْنُ قَوْمٌ, we are a people. لَا نَأْكُلْ حَتَّى نَجُوعْ, we do not eat until we are hungry. وَإِذَا أَكَلْنَا فَلَا شَبِعْنَا, and when we eat, we do not fill up everything. So the ability to control food intake is central to the prevention of many diseases that plague humanity today. Diabetes mellitus, heart diseases, cancer, all of these diseases of modern life are because people eat too much. We need to control the food we eat, and the Prophet ﷺ did teach us in a very clear way. So a Muslim who follows the teachings of the Prophet ﷺ will be moderate in their food intake. And if they are moderate in their food intake, they will live healthy lives, and they will avoid many of the diseases that we have got today in our community because of excessive food intake. The Prophet also, by his actions, taught us how to be physically active. Physical inactivity is a cause of many of our chronic diseases. The Prophet ﷺ himself was very active. He used to walk fast. He never walked lazily. He used to walk fast. Harwala. When he was walking, actually, he was like jogging. The Prophet used to engage in sports. When he was young, he used to wrestle. The Prophet ﷺ used to do foot racing. It's reported from him that when he married Aisha, while she was still young, he used to foot race with her. When she was young and thin, she used to defeat him. But later on, when she became older and a little bit heavier, the Prophet actually used to defeat her in this foot racing. He was very active physically. The Prophet ﷺ used to climb mountains. It's reported that one time he and Abu Bakr and Umar and Uthman went on Jabal Uhud, the mountain of Uhud. This is a very big mountain in Medina. When you go to Medina, you can see this mountain. So the Prophet was on this mountain when there was what we know today was an earthquake, because the Medina region of Saudi Arabia gets earthquakes from time to time. So Uhud was trembling. The Prophet told the mountain, "Ithbut ya Uhud, Uhud, be steady. Inna alayka Rasulullah, the Prophet of Allah is on you. Was Siddiq, this is Abu Bakr, was Shahidan, and two martyrs," referring to Umar ibn al-Khattab and Uthman bin Affan. So the Prophet was climbing mountains. He was very active. He used to encourage the Sahaba to teach their children to swim, to teach them to ride animals, to teach them to throw, so that they can be physically active. Now, if we follow the teachings of the Prophet ﷺ, and if we follow his own personal example, we shall see that there is a lot of guidance in Islam about healthy living. I talked today about only two aspects, but there are many other aspects that we can talk about. I talked about control of food intake so that we eat moderately. I also talked about physical exercise. But there are many teachings in Islam about hygiene that will prevent infectious diseases. We will not go into all of these details. I think this will be sufficient. Now, we need to take back the message that there are many teachings in Islam that directly relate to disease prevention and health promotion. We need, as health practitioners, to learn all the ahadith, to learn all the verses of the Quran that relate to these things. We need to use them in our health education programs, because when the health education message is packaged as part of a religious teaching, people take it more seriously. They internalize it deeper, and they are more likely to act upon it than when we just tell them a message about living healthy in a normal way, which they can listen. It goes in one ear and goes out the other ear, and they continue living their lives as they have always been living them. Thank you very much for listening to me. Wassalamu alaikum wa rahmatullahi wa barakatuh.